Hi guys, this is Charles. I'm one of the surgeons at South Paws. Today I'm just going to do a quick review of a very complicated case. This dog was a gastric irritation volvulus that was operated on Sunday, so about 3 days ago. And when they did the gastropexy, they inadvertently punctured the diaphragm, and so then it got a pneumothorax, and since then it's also developed very severe aspiration pneumonia. It's just constantly refluxing food up through its mouth. So it has a pneumothorax that's being treated now with 2 chest tubes on either side, one on either side, and so we think that the pneumothorax has come from the air that was free in the abdomen from the surgery that's penetrated the diaphragm through the neck, and the diaphragm has gotten up into the chest cavity. So pneumothorax persisted overnight. This morning we have gotten no free air from the chest cavity, so it looks like basically we've evacuated all of the air that was in the abdomen up into the chest and then out through the chest tubes. He's on a ventilator, so you can see here the ventilator setting. So we've got 4.5 millimeters of mercury of PEEP, which is positive end expiratory pressure. Tidal volume is 433 mils. And you can see its pressure volume loop here. And we'll come over and have a look at all the different medications it's on. So it's on noradrenaline, which is as a pressor drug. It's on fentanyl CRI, midazolam CRI, propofol CRI, metoclopramide CRI in order to try to control or tighten that lower esophageal sphincter. It's also on glucose and amoxiclav and a few other things as well. So this is highly intensive care case. We can see all the IV lines going into the patient here. We've got a urinary catheter at the bottom there. We've got suction set up, just waiting to evacuate its mouth because it's regurgitating all of so much fluid from its stomach up into the esophagus, and so we've got a endotracheal tube that's has a cuff inflated to try to prevent further aspiration, and then we've got this ventilator connected with the pressure volume loop here, and then we've also got it on a intra-arterial catheter in order to measure beat by beat the blood pressure. So that's the arterial line down there in the foot. And then coming up here, this is the monitor that we've got, so you can see that its blood pressure right now is 115/51 with a heart rate of 104. And the nice thing about having an arterial catheter is that we can measure blood pressure beat by beat, and so it just makes it much easier to manage things like the noradrenaline that we have it set up on here, and so you can adjust that up and down to maintain the blood pressure in the normal range. So anyway, a really challenging case. The ECC crew here at our hospital is doing an amazing job with him. The level of intensive care that we're able to provide over the past probably 4 to 6 months since we've gotten a fully staffed ECC team is just amazing. And the cases that they pull through that in the past would certainly have passed away is amazing. So anyway, thanks for watching. We'll see you again soon.